Hello and welcome to Medical Dialogues. I am Dr. Bhumika. Let's look at today's top medical news. 5 new papers in Lancet unveil cancer barriers and solutions in South Asia. A series of 5 papers published in the Lancet Oncology by a University of Pittsburgh-led international team highlights critical public health challenges related to cancer control in the 8 countries that form the South Asian Association for Regional Cooperation and the Rohingya refugee population in Bangladesh. The series underscores barriers contributing to significant disparities in cancer outcomes and identifies actionable solutions to address these challenges in one of the most comprehensive efforts to understand this region's cancer burden. The papers call for a comprehensive, coordinated approach to address the cancer burden in South Asian Association for Regional Cooperation countries, that is Afghanistan, Bangladesh, Bhutan, India, the Maldives, Nepal, Pakistan and Sri Lanka. Although cancer incidence rates in South Asian Association for Regional Cooperation countries are lower compared to the rest of the world, mortality rates are higher. Cancer incidence is on the rise, with lungs, breast, oral and cervical cancers the most common. This is largely due to late-stage diagnosis because of the severe shortage of early detection program, limited access to treatments and inadequate healthcare infrastructure. In the series of papers, researchers describe barriers specific to each South Asian Association for Regional Cooperation country and those that are common across the region. Pregnancy activates defense mechanism against natural flu. Researchers. McGill University scientists have discovered that pregnancy may trigger a natural immunity to boost protection against severe flu infection. Contrary to the common belief that pregnancy increases vulnerability to infections, researchers found that it strengthened an immune defense in mice, blocking the influenza A virus from spreading to the lungs, where it can cause severe infection. Our results are surprising because of the current dogma, but it makes sense from an evolutionary perspective, said co-lead author Dr. Mazhar Devangahi, professor in McGill's Faculty of Medicine and Health Sciences and senior scientist at the Research Institute of the McGill University Health Center. A mother needs to stay healthy to protect her developing baby, so the immune system adapts to provide stronger defenses. This fascinating response in the nasal cavity is the body's way of adding an extra layer of protection which turns on during pregnancy. Study highlights association between arsenic in drinking water and kidney cancer risk. New research findings from the Texas University School of Public Health indicate that exposure to even low levels of arsenic poses significant health risk, including an increased risk of kidney cancer. Their findings, published in the Environmental Pollution, examined the relationship between kidney cancer rates and arsenic levels in drinking water across 240 Texas countries. The team analyzed cancer data from the surveillance, epidemiology and end results on 28,896 cases of cancer among adults in Texas aged 20 and older, alongside water testing data from the Texas Department of State Health Services and the Texas Water Development Board. The analysis found that exposure to between 1 and 5 parts per billion raised kidney cancer risk by 6%, and exposure above 5 parts per billion raised the risk by 22%. In addition, the risk of cancer increased by 4% with each doubling of water arsenic levels. How sleep deprivation worsens dementia symptoms and aggravates heart disease, diabetes and more. A new review published in The Aging compiles findings from recent studies on how sleep problems such as insomnia, sleep apnea and disrupted sleep cycles can worsen dementia and accelerate cognitive decline. It also emphasizes the profound impact of these sleep disorders on caregivers who often face burnout and emotional stress. Such issues go beyond causing fatigue. They accelerate memory loss, increase confusion, and raise the risk of behavioral symptoms like agitation. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.